One. Hello, everybody, and welcome to the community editions of 5 Questions with Sarah Downey. I'm Sarah Downey, and I'm the President and CEO of the Michael Garron Hospital. And today we have a special guest with us. We have Dr. Kyle Vojdani, who is the Chief and Medical Director of the Emergency Department here at this hospital. So welcome, Dr. Vojdani, to this 5 Question session.
Thanks for having me.
So my first question is kind of an introductory one, but can you tell me what you do as Chief of the Emergency Department, and tell us a bit about the Emergency Department here.
Sure. So I'm an emergency physician here at the Michael Garron Hospital Emerge, and as Chief and Medical Director, I'm responsible for overseeing the care provided by our more than 50 emergency room physicians. I'm also part of a leadership team that oversees the larger team. And so that involves and includes more than 150 nurses and 50 allied health and support staff. The Michael Garron Hospital is a busy community teaching hospital. We see more than 80,000 patients a year. And we see a very varied patient population. So all the way from infants and babies through adults and seniors. We are part of a very vibrant community. We service not only our local communities, but many extended communities, including many high needs and socially disadvantaged communities. We're open 365 days a year, 24 hours a day for the needs of our patients.
That's great. Thank you. And when were you appointed?
I was appointed in December of 2019, so just pre-COVID. So it's been an interesting learning and an interesting experience, and it's been wonderful, though. It's a great team and a great hospital to be part of.
Great. So can you tell us a bit about how the Emergency Department has prepared for COVID-19?
Absolutely. So a lot of work and planning has gone into preparations around COVID-19. Really, the department has been completely redesigned and reimagined to ensure safety for both patients and staff. We now have many different zones, both COVID and non-COVID, attempting to keep patients safe after they present in the emergency department. The process actually starts from the moment you present through the doors. You're screened by one of our triage nurses, and a detailed history is taken and a preliminary examination is taken. Based on these features, you are put into different zones in the department, ensuring that patients with similar presentations are kept in similar spaces, and again, to maximize minimize the risk for all patients. Beyond that, we're sort of very proud of some of the additional work we've done. We've moved to a universal masking program for our emerge patients. So essentially, if you present to our emergency department with COVID and non-COVID symptoms, sometimes even completely unrelated symptoms, you're given a mask, you're instructed to perform hand hygiene, you're reminded about social distancing. And all of our processes are designed to ensure that patients are able to maintain that degree of social distancing within the emergency department. And furthermore, we've worked on ways to improve and expedite care within the emergency department. So patients aren't waiting as long for imaging, aren't waiting as long for testing, to ensure that their visits here are expedited, again, to further decrease the risk. I think another big part of why I feel that we continue to make sort of great strides in our preparations around COVID is that we have implemented a very robust staff screening program. So essentially all staff are screened prior to starting their shifts to ensure that they have no symptoms. And certainly if they have any symptoms that may be in any way related to COVID, they are not able to work, and they are to report for testing to ensure that they are clear before returning back to duty. It really is an impressive feat to watch the whole team prepare. Everybody from our nurses to our physicians to our patient attendants to our cleaning staff, they all understand the mission. It's every surface is being cleaned, every floor, every chair, every wall, to ensure again that the risk of transmission within hospital is low and that safety remains the priority for us and our patients.
Great, thank you. What are the biggest changes you've observed in the emergency department since the pandemic began?
It's an interesting question. I think it's probably one of these things that keeps many of us up a bit at night. I think that, as COVID emerged as a real threat to our community and our society as a whole, we in the emergency department prepared. And our community also did the same. So they washed their hands, they socially distanced from their friends, their family, and they avoided the hospital and they avoided emergency departments, really ensuring that we maintain capacity for the sickest amongst us with COVID. I think, truthfully, it's quite impressive to see some of the work that's been done. The challenge is that I'm worried, and I think many of my colleagues are worried, that some patients who do require emergency care or urgent care are actually staying away from emergency departments unnecessarily. I think they're staying at home, trying to manage their symptoms when really there is help out there for them. And I think that they just need to know that we are here to help them. I think us, like many other emergency departments throughout the city, have noticed a decrease in our patient volumes. We continue to see COVID patients and very ill COVID patients, but those patients that we would have traditionally seen with severe chest pain, with heart attacks, with severe shortness of breath, with advanced asthma or COPD, they are not coming. And I think that to some extent, some of it has been mitigated by the fact that people are listening and socially distancing and not carrying out activities where they may need emergency services as much. But I do worry that there are a proportion of patients who really probably need care who aren't presenting. And it's really saddening to think that they may be suffering at home unnecessarily.
Right. And you've answered it a bit already, but I'm going to ask you to repeat some of it. Is it safe to come to the emergency department? When I talk to people, they say, I'm sure if I go up there, I will get COVID. And so that's why they suffer at home and don't come in. Is it safe? And how is it safe?
Yeah, so it's a great question. And I believe the answer is yes. I believe emergency departments remain safe. If you have an urgent and emergent issue, you should present to the emergency department. Again, I think my concern is that patients are staying home with their serious medical issues, and that in certain circumstances, doing so can actually cause irreversible damage. Treatments become more complicated and less effective when you show up late to the hospital. And it really is a bit saddening to see actually examples now of patients presenting to the hospital in much later stages of their illness, often requiring significantly more complicated and less effective therapy. Seeing patients coming into hospital with chest pain for a week and finding out that they have a heart attack, or seeing parents trying to manage, critically ill babies at home when really there was help close by. I think, I certainly understand the concerns that patients have, and I certainly understand the fear around potentially contracting COVID in some of these settings, but I really want people to know that the hospital remains a safe place for them, and that we are taking precautions to ensure that their care can be delivered safely in an expedited manner. And I just want people to know, again, that we're here for them if they need us.
Great, thanks. So you've given some of the advice, but maybe reiterate when decision to come in.
So yeah, this is a bit of a challenging question, and I know many patients are really trying to make smart decisions around when to come in. I think we have to, in many respects, rely on our previous established system. So if you're worried, I would reach out to your primary care physician. I would reach out to your pediatrician. I would reach out to your specialist and ask their advice. And certainly if they're worried, you should present to the emergency department. But truthfully, in the absence of that, if you're having severe chest pain, if you're having severe shortness of breath or abdominal pain, really, if you're having severe pain or you're worried, we're here for you and we want to see you. And I don't think that, staying at home for fear, again, of contracting COVID in hospital really is a safe thing to be doing at this stage. We remain ready and we remain prepared to keep you safe and to treat you if you present to the emergency department.
Great. Thank you, Dr. Vojdani. I think everybody's going to hear in your answers to those questions just how much you care about our community, about the size and breadth and depth of our emergency department, which is incredible. And I know many of the people who work there and are so dedicated to great patient care. You've got a great team in there. And I sure hope that the people listening to this video will understand how we keep people safe and when to come into an emergency department, and also appreciate that we are here to serve them all. So thanks for all that you do to take care of patients and keep us safe. Have a good day.
Thanks for the opportunity.
My pleasure.